Hey everyone, welcome to video 5 of our patient education series, and we are going to be going over the two entire spinal views that we use to analyze posture. So there are two, like I said, there is one from the front to the back and one from the side. We're going to start with what we call the coronal posture, or how your spine looks when we are looking at it from the front. This is a posture that we want to see a nice neutral spine, just straight up and down. Here's a picture of that right here so you can see what that looks like. Whenever we have an abnormality in this region of the spine, or in this view of the spine, I should say, typically it's either an abnormal posture, so the patient is leaning to one side, they might have a compensation somewhere where their body's trying to maintain a neutral center of gravity. But the other common abnormality in this view of the spine is scoliosis. Many of you might have heard of scoliosis. It's a lateral curvature of the spine from this view, basically curves that go to one side or the other. And here's a picture of what a scoliosis looks like. Now with scoliosis, there's a lot of different reasons that it can happen. It could have developed in childhood. There may be a genetic component. We tend to see that it runs in families. But most of the time, patients are prescribed PT. They might get a brace of some kind, but most of the time, those are only going to do so much. And our goals here are to correct the scoliosis if possible. Most of the time, we have to catch a scoliosis fairly early to correct it. The golden age of treatment, so to speak, is between the ages of 10 and 14, when the child is still developing and the spine is still very malleable. We can mold it and guide its development. As we get older, we can get correction. Tends to be a more aggressive treatment plan, but a lot of what we do with scoliosis in our older patients is just try and make sure that it doesn't progress to the surgical stage. That in and of itself is a great goal to have, because scoliosis surgeries are rather intense, and once you go under the surgery, your spine will never be the same. It won't move the same. You'll have loss of flexibility, all these different issues that can come up from having spinal surgery. So again, when we're looking at the spine from the front, we want to see a nice neutral posture all the way down. Next, we've got the spine from the side. This is called the sagittal view of the spine, and here's a picture of that so you can see what that looks like. Essentially, when we're looking at this view of the spine, we really want to see what's called a neutral gravity line, where essentially your spine has certain markers in it that we analyze in our software and show you during your report of findings. And we want certain markers on the spine to be lined up right on top of each other, again from the side view. This is going to basically keep your spine in a neutral position when we have those markers lined up. That correlates to proper posture, lower amounts of degenerative forces on the spine, better nervous system function, better balance. One of the great things about having a good posture in this area is that as we get older, it actually is correlated with decreased rates of falls and decreased rates of just overall negative health conditions. So having proper posture can literally prevent you from having negative health consequences down the road of many different kinds. They call it all-cause mortality. Just your risk of catching a serious disease goes down when you have neutral posture from the side view. So establishing a neutral posture from the side, again, sagittal balance, is what we really strive for with all of our patients. This is accomplished with exercises, the traction, the adjustments, the home care that you have at home. So go ahead and make sure that if you have any questions, bring it up at your next appointment. I'll be happy to ask them. I'll see you guys on the next one.